McGill Big 3 exercises. We're going to start with the curl up. So if our patient is having any neurological symptoms into her leg, that leg we will instruct the patient to bend up. So we're going to say that this patient has neurological symptoms into this leg, so she's going to bend this leg up. This will take the neural tension out of that nerve on this side. We're going to have our patient place her hands underneath her lower back with her fingertips just touching. We're going to make sure that they are in the correct space and that the fingertips are touching. We're doing this so that the spine has something to buttress itself against, not so that we're affecting the change in her spinal curves. We're going to ask our patient to perform her brace. Good, and that she's going to be contracting that at about 4 or 5 out of 10. Patient is then going to lift her elbows up. She's going to tuck her chin ever so slightly and lift up from the chest, just to the point that her head clears the ground. As if it was on a weighing scale, the weighing scale would now read 0. She's going to hold this for 10 seconds. We'll count back at this point from 5. Patient will count back.
4, 3, 2, 1.
The brace will stay on, head and shoulders will come down, brace stays on, elbows will come down. The brace at this point will be dialed down to about a 1 or 2 out of 10, and then the patient will repeat the cycle for 10 repetitions. Patient will form her brace, elbows will come up, tuck chin, and will come up just to the point that her head clears. Patient is still breathing and would count back from 10.
9, 8, 7, 6, 5,
Maintaining her brace.
4, 3, 2, 1.
Maintaining her brace, head will descend downwards, elbows soften down, and patient will relax her brace down to around a 1 or 2 out of 10. You'll do this for 10 repetitions, and that would be the curl up. We'll move into the second exercise, which is going to be the bird dog. So we'll get you up onto your hands and knees. Okay, so we're going to have our patient hands and knees. She's going to contract her brace. She's going to lock her lats muscle down as if she's going to be doing a pull-up, and will come up and hinge forward at the hips with a full contraction into a tabletop position without changing her spinal curves. This is her neutral spine. We're going to have her knee underneath her hip and her hand is underneath her shoulder. Legs are just outside of hip width. Patient is going to grip the ground with her hands, and we're going for a full body synergistic muscle contraction. So she's gripping the ground, she's locking that lat muscle down to protect her lower back. She will adopt her brace, and now we'll take this leg out to the side and push back with the heel whilst raising this arm out to the front. And she will hold this for approximately 10 seconds. As you can see, there is no hinge or curve into her lower back, and she will bring both back into the midline. Leg will come forward, then tuck back in with full control. She will then soften her brace by a couple of points and proceed again on the opposite side. Brace, leg out to the side, and we'll push back with her heel, staying low so it doesn't curl into her lower back, and at the same time the opposing arm will go forwards. She will keep this for around 10 seconds and then bring them back into the midline with full control. And as you can see, no movement in her upper body or lower back. And that would be the bird dog. We would aim for around 3 sets of 10 repetitions. We're now going to move on to the side plank. So we're going to have you lie on your side facing the camera, Sarah. As much as possible, in between transitions of the exercises, patient will always keep their brace at around a 4 or 5 out of 10. You're going to have the patient on her side. You're going to make sure that her neck is comfortable. Sarah's using her arm. And we're going to have her in this position, and we're going to ask her to have her top foot in front with a heel toe touching. She's going to have this hand on her hip, But first we're going to get you up onto your forearm with a brace here, and the hand is going to go onto the hip. If Sarah had any shoulder problems, she could support her shoulder with this opposing arm. She's going to dial in her brace, and then the instruction will be to move the hips forwards, which will bring her up into the side plank position. So hips forward, Sarah, which brings her up off of the ground into a side plank position with no twist. She is breathing, and she will hold this for between 5 and 10 seconds, and then the instruction will be to pull the hips backwards, which will lower her down onto the mat, and that would be 1 repetition. Sarah will dial the brace up, the hips will go forward, which will bring her up off of the mat into a perfect side plank position. She will come out of it by pulling the hips down and back, and that would conclude the series of the McGill Big 3 back rehabilitation exercises.